From the station that's on your side, this is Channel 7 News Daybreak.
All right, think about your sleep last night. Could it have been better? Do you need to improve your sleep? Yes to all those answers right here on Daybreak. Stay awake and pay attention right now because Baptist Health's Dr. Jheanelle Dawkins from Sherwood Family Medical Center is here with some good advice for you. Let's talk, Dr. Dawkins, first of all, good morning. Thanks for joining us. Let's talk about how much sleep we should get a night. On average, what's the recommendation in the medical field?
So on average, the recommendation is 6 to 8 hours.
Okay.
But they give us a caveat about quality sleep, right? So what's quality sleep? Quality sleep is when you're able to fall asleep within 30 minutes of laying down and not waking up more than one time for the night. And if you do wake up, falling back asleep within 20 to 30 minutes.
Okay, what happens if we sleep poorly to the body over time? And not just one bad night, but over time.
So over time, the body's going to break down.
Okay.
I think about it, I tell my patients all the time, you know, your sleeping is like when you turn your cell phone off. You know, if your cell phone's not working properly, you turn it off.
Yeah.
That's what we need to do.
Get the reset?
Hit the reset.
What about medical conditions that could follow, not just the body breaking down, but what is poor sleep associated with in terms of conditions?
So in terms of mental health, you know, it causes a lot of confusion and just, you know, in terms of other health conditions, it increases your risk of type 2 diabetes. It increases, you know, your risk of high blood pressure and obesity.
How about sleep schedules? What can you tell us about those and how can we improve and get on a consistent sleep schedule?
So that's a topic that my patients and I talk about whenever they come in and they're like, Doc, I'm not sleeping well. I say, well, what's your sleep schedule? And they look at me like, what are you talking about? My kids are on a sleep schedule, but I'm not on a sleep schedule. So we have to get back to having a sleep schedule. You know, it's researchers, not Dr. Dawkins, but researchers and neuroscientists, they state highly that people that have the best quality sleep have a sleep schedule. You have to have time to wind down, meditate, and get your mind in the zone to go to sleep.
What about some advice whenever you're trying to wind down? What should we not be doing?
We should not be doing what we all are doing sometimes, right?
Of course.
Being on our cell phones, watching TV. I wear some blue light glasses. There's a research project that came out that shows that if you wear some inexpensive blue light glasses while you watch television in the afternoons, in the evenings, this helps your mind get less light, right? So it's all about neurochemistry, and what you feed the mind is what you're going to get. So less light, you're preparing your body for sleep. So you should not be reading in bed. You should not be, you know, using your cell phone in bed. You should not be on your iPad in bed. And that's, you know, there's several apps out here. If I start calling them by name, I'll probably get in trouble because I can't list them all.
Okay.
But there's resources out here to help you come up with a sleep schedule and discuss things called sleep hygiene.
And speaking of discussions, if someone has been sleeping poorly consistently, at what point should they probably reach out to their doctor and maybe look further into why they're sleeping so poorly?
Right. So first and foremost, if you are having shortness of breath when you sleep, please come in and see a primary care physician. This can be an issue that needs to be investigated. If you're waking up more than more than one time, the research says, but if you're waking up, you know, more than twice per night, we want you to come in and be seen.
Okay. And go talk to your doctor as soon as you can, because as she mentioned, it will break your body down if you don't get the proper amount of sleep. Thanks again, Dr. Dawkins, for stopping by. Hey, you can contact Baptist Health by going to the Baptist website. It is baptist-health.com, or calling the Baptist Health Line, 1-888-BAPTIST.